Good afternoon, everybody, and welcome to our June 16th provider conference call. We are glad that you're able to join us today. And first, can we see if you can hear us? If you'll just type in, you can hear us in the chat box.
Awesome. Thank you so much.
Thank you. And I'm Elizabeth Viola, the Chief Program Officer at the Early Learning Coalition. And I'm not going to forget to introduce the team who is in here today. So let them introduce themselves.
Good afternoon. This is Marcy Easter, Business Information Director.
Hi, everyone. This is Scott Stevenson, Quality Initiatives Director.
And Deanna Johnson, Chief Finance Officer. And Roseanne Fritz, the CEO here at the Coalition.
So welcome, everybody. We're going to jump right in today, and Scott's going to kick off our agenda.
All right. Good afternoon, everyone. First item on the agenda is the Provider Appreciation Classroom Kit. So annually, we would typically hold Provider Appreciation with everyone to show how much we do appreciate you, and there'd be an event. Of course, this year, due to COVID, unfortunately, that could not happen. But we didn't want you to think we forgot about you. We don't appreciate you. So what we've done this year is we've put together a kit. All sites will be receiving this kit. And in the email that Elizabeth sent out earlier, it actually lists and shows you all the items that are going to be included in your kit. So we got word, and Marcy has it up on the screen. So we got word last Friday that the shipments have gone out. We're hoping maybe some of you have received one, maybe not, but they should be arriving shortly.
Yeah, they have started coming in. So we've gotten a couple emails thanking us, so you're super welcome. And
awesome.
Yeah,
that's good news.
Yeah, take pictures of the kids interacting with your stuff, send it over to us so we can post it on Facebook as long as we have releases, and everybody's social distancing and all that good stuff. Scott, you want to talk about how we're going to take inventory that everybody got their package?
Yeah. So normally we would be doing this because we have it delivered to the coalition, but since it's coming directly to you all, there are a couple things we need you to do in order for us to invoice this stuff to pay the vendors. So when you get your items, when you open up the box, there will be a packaging slip inside the box.
Oh, I'm sorry, there's no packing slip. We just found that out today because one of you thanked us through email and said, there's no packing slip. What do you want us to do? And I forgot to tell Scott. So sorry about that. But there isn't a packing slip, but you can shoot us an email.
Yeah, no worries then. So the items that Elizabeth sent you and that's on the screen, you can use that as kind of to take inventory for your boxes. So what we'd like you to do, what we need you to do as soon as possible, as soon as you get these boxes, is to take a quick inventory, make sure all the items were received, sign your name and date one of these forms that we're seeing on the screen, and we need you to upload that into BlueJeans. So it's sign it, date it, put 100%, and we'd be good to go. If there are by chance any missing items, we ask that you would sign and date the form and just list the items that we're missing. So a member of our quality staff is going to be assigned. They'll be assigned to providers, and they'll be doing follow-up and checking BlueJeans. But again, just as soon as you receive your kit, if you could do that for us and upload it to BlueJeans as soon as you can.
And we put this kit together to kind of serve every age group that you have. So if you're VPK only, you should still find value in all the items that are in there. And I'll tell you something, my favorite item in there is the Mini Masters art book set. That is something that I've never seen in a board book set before, that you can use from infants all the way up through your school agers, and it talks about different artists, and that's my favorite thing in there. We would love to know what your favorite thing in there is and how you're using it. So, share with us so that we can share and brag about you. Becker's worked really closely with us on this to make it a really seamless transition so you could get your kits. And we've had other counties actually ask us about them and want to duplicate it. So we hope you enjoy those. Thank you for all that you do. Scott, is there anything else you want to say about that before we go?
I think that's it for the kits.
Do you have any questions?
This list has already been emailed out to you
on Saturday and then today with the agenda again. It was an attachment to the email that I sent.
And when are we supposed to get our kits?
anytime now. We've already had providers that are getting them. I know of at least 3 that have gotten them and 3 on here. So I don't know if that's 3 separate, but like I know Family Ties got theirs because I already got an email. Thank you, Karen, for letting us know. We love that you love the products. Little Gemstones reached out to me, and I think
Yes.
Triumphant Tots or Alphabetly. Jennifer, Kayla Berg, you're one of our brand new ones, so we're glad you got yours.
Stephanie.
Each set gets 3 boxes. Yeah, your shipment will come in 3 boxes. Thank you. All right, so if you have any questions about that, just know that one of our team is going to reach out to you just so we can make sure you got your stuff and that nothing was missing. Each kit has 10 different items in it, and each item is described in the attachment to that email that went out today. Moving forward on our agenda, there was a lot of activity that happened last week. And so your email, if you noticed, that was from me on Saturday afternoon, was very involved. It had a lot of pieces to it. I actually have it in front of me because I want to make sure we can go back to it if we need to. One of the big things in it was a 142-page PowerPoint presentation on the CARES Act. Okay, we were able to, with OEL's help, they sent us some key pages, and then I went in and pulled out even more key pages for you that was starting on page 94 of that PowerPoint. Now, a lot of work was put into that PowerPoint, and I think it's important to kind of take a moment and reflect on that because there are a lot of live links, say that 5 times fast, live links in that PowerPoint presentation that will take you to a lot of different support components, things like mental health support, things like just general health and safety techniques all throughout, and the plan for how to administer things throughout our community and our state as we move forward with reopening schools and getting back into the swing of what our new normal life looks like. So I wanted to just kind of touch base on that and give you a couple of pieces of information that goes along with this CARES Act that we've been talking about. So at our last call, we talked about parent fees, I think just briefly. Since then, so we were told parent fees will be paid by the coalition through June 30th. That has now been extended through July 31st. Sorry, I'm doing that whole nursery rhyme in my head, 30 days, has September, April, June, and November. So, yeah, so through July, and everybody's nodding their head. Yep, you got it. July 31st. So the coalition will continue to pay parent fees for all children through July 31st. Okay. The other piece of that for first responders, we've had a lot of questions from providers asking us about how long will the first responder program go on. So at this point, we've been given the directive that it will go through September 30th. Okay, so you may see some renewals of parents' referrals. Once that happens, their referral will be extended for another 90 days. So it's possible it could go past September 30th, but at this point, we will not enroll any new first responders or essential medical professionals after September 30th. And that, of course, keep in mind, these are all the directives we know of as of today. Okay, so as things change, we will keep you updated, of course. So just to summarize what I just said to you, ELC is going to pay the parent fees through July 31st for all of your enrollments. And the first responder essential medical personnel program, we will continue to enroll families up until September 30th. So those are 2 different dates. I'm looking at Marcy, and it looks like she wants to add something. No. So we don't, at this point, that is what we know of today. Let me pause and see if there's any questions.
None right at this moment. Jonathan Pitts, I'm not sure which site you're with. You do have your hand raised. I'm going to unmute you, and you're unmuted if you need to ask a question.
Hi, Jonathan.
I'm sorry, I hit the wrong button there. I'm over in Levy County, but just participating for the info.
Awesome. Thank you. Welcome.
Okay. Those currently enrolled in the Essential Worker Program are approved through 9/30.
Not only if they have a new referral. Okay, so you'll have to continue to watch EFS Mod. And that's actually another piece I want to add to it. We are reaching out to all those parents because those parents have to upload the same information as your regular school readiness enrollment. So the proof of residency, the proof of citizenship for the children, the IDs for the parents, and potentially pay stubs if they want to carry on with the program. We ask for all of that stuff. Now, the pay stubs wouldn't necessarily stop us from keeping them enrolled, of course, because this is a referral program. But if parents are not uploading that information, then we are not going to be able to renew their service for another 90 days. So not all, to answer your question, not all of the parents will be renewed, but we are trying to renew as many as we possibly can so that they can continue to take advantage of the program and assist the families as much as possible.
Does this mean you will be paying for non-attending children through to July 31st?
So the answer to that is that we can pay for children based on your enrollment through July 31st. So it's based on enrollment of open providers. So if the provider is closed, there is that survey. We're going to talk about that in a little bit, actually next on our agenda. So right now we are paying for your enrollments for open providers. So remember the difference between enrolled and attending. Now your first responders, let's talk about your bonuses for a second because there's a different piece that goes with the bonuses. In order to receive a bonus, they have to have attended at least one day in the month to qualify for that bonus. And just to summarize the bonus one more time for anybody who is just now seeing that, the bonus is for up to 8 children that are enrolled as the BG1 ESS, and that is the First Responder Essential Medical Personnel Program. You can receive a bonus of up to $500 per child per month with a maximum payout of $12,000.
The maximum payout of $4,000 a month.
Per month, yes. Thank you. There's so many details to this. So it does take a team. It takes a team to run these meetings. It takes you all participating and asking the right questions, and we appreciate it. So
while you're on that, so the other tricky part with reimbursement on your ESS children is they have to attend the one day for the bonus, but you do not get to start claiming them for that month until they attend the first day.
And that was something we had to get clarification on too, because a lot of you had parents that were paying for their seats, and we've had some conversation about that. They were paying for the spot so that you didn't fill their spot, and some of you were really torn. Do I fill that spot and tell that parent thank you, but I need to serve a child that needs it, the tier? And the clarification on that is they do have to, you can start claiming them after they start attending. So
we've got about 3 more questions.
3 more questions, and then I do want to talk a little more about what you're going to see in this CARES Act piece.
Okay. Providers asking that they didn't get paid for one of the first responders. In April, when we just processed May's, we are going back and looking to see if any of those enrollments got processed for April, got processed with May's attendance. And we are going back to April and looking for both attendance and bonus to compensate for that. We will do that each month, knowing that some of these referrals are still going back to April 1st.
Yes, and we're trying really hard to make sure we keep up with that. This is a very unique program in the fact that we are going retroactive for a lot of the enrollments, which is not normal for us. Let me add something to that. we have some providers that are really resisting wanting to give the parents their co-pays back, those that have already paid. What I can tell you is if you are choosing, and this is a choice for you, if you are choosing to participate in this program, then you are choosing to go with the rules around it, which means that you have to give back the parent copay. And I know it's hard. I know it's hard to go back and say, okay, but they've already paid us since April. We're 3 months later now. We know it's hard. It's just as hard on our end too. So we're feeling your pain. But if you are choosing to take those bonuses and you are choosing to serve these children and you are choosing to allow these first responders and essential medical personnel to enroll in your program, then we need you to choose to give that parent back their credit. I can tell you the parents are calling. I have a list of providers, and I can also tell you it's only about 3, so that's awesome. But I have a list of providers that I'm going to be reaching out to and having that heart-to-heart talk with you about how can we make this easier for you, and let's brainstorm on ways that will allow you to do what you have to do and also meet the needs of the parent in this program so that you can keep getting the benefits of bending over backwards like what you're doing. All right, so let me get off that. That was my mom lecture for the moment. What other questions? We're good? Mm-hmm. Okay, so something else you're going to see in the CARES Act piece is that the state of Florida is looking at a way of also thinking the providers who are not school readiness contracted or VPK contracted. There is something that we are working on with the Office of Early Learning to provide a payout to some of those, all of those providers that are legally operating in our counties that are not contracted. If you know somebody though that is not contracted with us, tell them about all the perks. We want them to contract with us so that we can help serve more families. But you will see something in there, so I didn't want to just go over that and not address it. We don't know what that looks like yet. We're still working out all the details, but those providers that are not contracted will also receive a financial support as well, based on whether they were open on April 30th, 2020. Our MiniGrants are in full force. Most of you should have gotten your email already if you haven't, about your qualification. You want to add anything to that, Scott?
I don't think so. With MiniGrants, yeah, emails went out last week for those who applied and were eligible and should be receiving the $2,000. As far as other MiniGrant stuff, I can tell you right now, we're still in the works of processing teacher stipends. So that was a little bit different because you still have an opportunity to submit those. You can submit those as long as the COVID emergency declaration period is in effect. And actually, I'll be going over a little bit more on that later on the agenda.
Okay, perfect. Another program you're going to see that's in the few pages that I pulled out of the 142-page slideshow, there's a transition to kindergarten program that's coming. I'm throwing that out there because you'll see some information in there about it. There's also a VPK to kindergarten progress monitoring system that is being looked at to implement. We don't have any data on either one of those programs yet. We don't have any additional information. We're just kind of setting the stage to let you know these are coming, and we will keep you informed as soon as we know more. And then there's some numbers in there that you can look at, and that is the majority of the CARES Act for us and how it impacts the early learning world. So let me pause one more time and see if there is anything additional before we talk about the next thing on our agenda. Any other questions?
Just one quick question about the MiniGrants. Is it per site or per provider if they're a multi-site provider?
It is per site. So if you're a provider who has multiple sites, you can submit an eligibility form for each of your sites and potentially receive up to $2,000 per site.
The next one is I applied for 3 sites but only received 1 email in reference to the MiniGrant. Who do I contact to check the status?
That would be me, and if that's the case, then if you could reach out to me personally, or if I don't know if Marcy can tell who that is there in the comment section, but I can reach out to you. I'd be happy to and go over that. It could be an eligibility requirement that we're still researching, but I'll certainly reach out to you and talk to you about that.
Yeah, I have 2 that want to be contacted, so we'll pass it on.
All right.
In regards to the first responders program, if the school-age student does not come for the day during the summer, will we be paid for a full day or a half of the day? Okay, now that summer is truly in effect, the school calendars are no longer in effect. So that your school agers should now be showing up on your attendance as full-time. No more flipping those kids.
Yeah.
So if they are not, then contact our family service to verify that they are eligible for full-time care during the summer.
Perfect. So, yeah, welcome to summer. It's almost official. It feels like it outside already. The last thing I want to talk about is something that's not on our agenda when it comes to the CARES Act, but yesterday the Office of Early Learning sent out an email to you all titled with the subject line Support for School Readiness and VPK Providers, COVID-19. And I just want to throw that out there. If you haven't seen that letter, it talks about, that email, it talks about SR and VPK providers that were open as of June 1st and July 1st. It talks about June and July service periods and closures. And then it talks also about those who remain closed July 1st, which we only have one now. Aside from those of you that do VPK only, we only have one site in Marion County. So I'm super proud of all of you. And the one site is trying their hardest to reopen. Theirs is just a different circumstance. So I'm going to make sure, I just want to throw that out there that email did come directly from the Office of Early Learning. I want to encourage you to make sure you are on their mailing list, that you're getting those emails. They are definitely partners and they are our funders, and we want to make sure that you're in the loop as much as possible. So check your spam if you did not get an email from them yesterday at about 3:20 p.m. is when it went out. Any other questions?
Yes, there's one quick question. Is the first day of payment requirement applicable to all SR enrollments or just ESS? That is applicable, and that is rule for all SR. A child can be enrolled, but until they attend that first day, we cannot pay absences until they attend that first day.
Yeah, that's been a rule for a while, so we just have to also respect that rule in regard to the BG1 ESS enrollments too. Okay, good to go. All right, item number 3 on our agenda are provider surveys that are available in EFS Mod now. This was something that just came to be on Sunday with an update that occurred to EFS Mod, or as a lot of you know it, the provider portal. Some of you may know it by a different name, but that's for another call. We have those surveys are available. One of them is about registration fees, whether you charge registration fees. Some of you filled out the coalition survey on that came out in, I think, the beginning of April-ish. Some of you filled that out. We only got about 22 providers that responded to that out of all of you. But this one is actually through OEL, and so we need everybody to participate in that. So the next time you log into EFS Mod, which should be pretty regularly so that you can keep up with your attendance, we will ask you to fill out that survey. It's pretty brief. I think it almost mirrors exactly what our survey was here that Marcy put together for us. So if you could participate in that, that is going to be in regards to what we talked about last summer about this time when we were talking about the Office of Early Learning implementing the new registration reimbursement, where we are going to help pay for registration fees for families that are coming into your site. The second survey is that closed provider survey. Now, a lot of you may not have that survey available to you at this time because you weren't closed at all in May. However, May was one of those weird months where the first day of the month fell on a Friday. So if you were closed the last week in April and decided to remain closed, then May 1st fell on that Friday, and you will probably have a survey that you will need to complete. please know that that is tied to your payment. If you do not complete that survey, you will not get paid. So we want to make sure you complete that survey. That's super important. That's why it has its own little number on the agenda, why we want to make sure we cover it right away, and let you know it is now available. So that was another thing that was updated on Sunday. So please, again, to reiterate, 2 surveys, one on registration fees, one if you were closed a single day in May, and you'll need to complete both of those pretty please. Do you have any questions? No questions. All right. So I'm going to stop talking and let Scott take the next one.
Okay, next on the agenda is VPK. I just wanted to start off about giving a little update on the providers who are on probation. Again, we've got about 42. So initially, we had set deadlines to please submit your improvement plans in the system no later than May 29th, and then June 10th. So as of right now, we still have about 25 providers who have yet to submit a plan. So while we gave you those dates earlier, we wanted to get you guys ahead of the game and make sure that there was room if we had to kick it back and you resubmit it. But the bottom line is with these plans, if you want to do a fall program, your improvement plan must be submitted and approved at least 30 days prior to your fall program starting. So for example, if you want to start your fall program on August 10th, your improvement plan must be submitted and approved by July 10th. So it cannot be any later than 30 days prior to your start date. So if you want to start your fall program on time as your calendar states, it needs to absolutely be done prior to that. I would encourage you to go in and do it today. Just do it as soon as you possibly can. So that being said, once all improvement plans are submitted, one of the responsibilities of the coalition is that we monitor your improvement plans. So someone from our quality staff is going to be assigned to your site, and we will be developing a short and simple tool, as simple as we can make it, to ensure that we're monitoring the plans and that the actions on them are being taken for you all to be in compliance. So whoever is assigned to you, those folks will be reaching out to you shortly. I'd like to do it sooner rather than later, so if you had not submitted your improvement plan, maybe they can help you or walk you through that as well. But again, it's going to be an ongoing thing, so this person is there to help you and assist you, but we also need to be utilizing our tool to make sure that you're in compliance with that.
Okay.
But before I go on, I just have one tiny other piece, but before I do, is there any questions about that? Okay, great. So that also leads me to VPK applications. All VPK applications have been initiated. However, just a very small handful have actually been approved. So next on the agenda, Elizabeth is going to talk more about the upcoming contract orientation that we plan to have for these. But before you can get a contract, the application absolutely has to be completed. So we've identified the week of July 20th. We're looking at right now the week of July 20th as the week we want to hold VPK contract orientation. So we are asking that you please complete and submit all of your VPK apps no later than Friday, July 10th. And they actually don't only have to be submitted by then, we need to have them approved by July the 10th.
Do you have any questions? Okay. So just to add a little more to what Scott was talking about, we are, every year, we do an orientation for both our school readiness providers and our VPK providers. And the orientation is to serve multiple purposes. One, because it's in our contract that you attend an orientation. Two, it makes sure that you have a clear understanding of what you're entering into when you enter into a school readiness or VPK. In this particular conversation, we're focusing on VPK, into that contract, because it is a legal binding contract where you have a responsibility and the coalition has a responsibility, and we want to make sure that we both understand each other and that everything is clear and we can answer any questions. And This year, we're going to do things a little bit differently where we pull in the quality initiatives team. The orientation is going to be virtual in the same format as this webinar is, where you'll be able to ask your questions if need be, and we're going to go over different pieces that the coalition offers to support you under this roof, the things that we have available to you, and make sure you understand the contract at that same time. Now, after you attend orientation, that's when we'll ask you to electronically sign your contract. And as we see that you were logged in for the entirety of the orientation session, because it does log. When you log into these calls, we can see how long you participated. So some of you log in and then you log out 2 minutes later, and we can see that. My feelings are a little bit hurt, not going to lie, but we also understand you have a lot going on too. But those of you too that stay on for an hour and 3 minutes or however long our meetings are, we can see that as well. So we thank you for giving that time. And we do have to see that you will have stayed on for the entire length of the orientation in order to release your contract then so that Roseanne can sign it. And she is the final signature that binds that contract and allows you to offer VPK. So once we go through those pieces, you'll be oriented, you'll have a better understanding of what the coalition does. I can give you a heads up that there's not a lot of changes in the VPK contract for this year, but those pieces that Scott mentioned, if you're a provider on probation and then finishing your VPK app, those are vital in order for you to participate. So that deadline of July 10th is huge to make sure that your application is up and is submitted so that our staff can review it and approve it and work with you if we have to make any changes. Do you have any questions?
One says, I haven't received a certificate since May 5th. So are they going to receive any other certificates?
Oh, for participating in this meeting, yes.
Yes.
I'm not, can you still apply for VPK at this point?
Yes. Okay. But we need to know who you are because Scott, first you have to do a profile if you don't have a profile already, and then you'll need to reach out to Scott, shoot him an email, stevenson@elc-marion.org, so that he can initiate your application. And then we can start from there. And if you need a meeting with one of our staff, our building is open. That's actually further on the agenda, but I can talk about that real quickly. We are capable of setting up a face-to-face meeting. We do ask that you wear a mask. We take a lot of precautions to ensure everybody's safe around here. We have a cleaning schedule. Our office is open on Tuesdays and Thursdays to the public. So we can schedule a meeting, and I know that I'll talk a little bit more about that when we get down to the bottom.
Rosalind Murray has a question about marking an A before a parent starts a new job. Go ahead and email that question to efsmod@elc-marion.org, and we'll take a look at the details of what you're trying to explain here and see if we can get some clarification for you.
Okay. No more questions? Okay, so the next thing I want to talk about on this agenda is to do with the summer VPK opportunities. I did include in the email Saturday and the follow-up today reminding you about it, the executive order that talks about summer VPK. Just want to throw out there, we have, I think, about 257 students who may be eligible to attend a summer VPK program because they didn't meet their 70% enrollment during the year. And that's not including any new students that didn't attend anywhere over the fall. So there may be other children out there. I know that there are other children out there who haven't gone to VPK that would be eligible for summer. Marcy was able to put that executive order up on the screen for you. But a couple of key things to know about this executive order, and these are bulleted out in my email to you, is that one, we have 257 kids that need or deserve to finish their VPK program. And two, the number of hours required for summer VPK have been cut down from 300. You're now required to complete a minimum of 200 hours. So let me give that a second and I'll repeat that. So the summer VPK used to be, pre-COVID, used to be 300 hours. This year, it has been cut down to 200 hours in order to hopefully encourage some providers to still offer summer because we have those children that are eligible to attend summer. The reimbursement will still be the same as if you were offering 300 hours, which is fantastic. So if you're choosing to offer summer VPK, the hours are now 200 hours for the program, and you also do not have to have that minimum of 4 children to start your program. So you can start, if you have 1 child enrolled, you can start your VPK program. Previously, it was that you had to have 4 children enrolled and attending. Remember, that's a big conversation we've had today. They actually have to show up in order to start your program. That has been waived for this summer due to COVID-19. Now, the other pieces of the program requirements have not been waived, so you still have to have a bachelor's degree teacher, and you still have to end your program before your fall program starts, of course. If you have any questions, let's see if there's any questions.
What are the ratios for summer VPK?
So ratio is 1 to 12, I think it is, off the top of my head, 1 to 11. Your bachelor degree teacher, 1 to 11. I would like to double check that because I feel like it's different for summer, and I'm sorry guys, I should have looked at that before I walked in here, but I want to double check that and we'll make sure you know the answer to that. Actually, I'm going to ask Scott to double check that for me. And he's Thank you, Sherry. Sherry, you said 1 to 12. I think I felt like 1 to 11 is the fall program, and then you have to have an assistant. I think summer is 1 to 12. There's no requirement for an assistant. Of course, assistants are always, I'm sure, welcome with 12 4-year-olds, but we will double check that just to make sure. I want to look at the ratio, and we'll make sure. But thank you, Sherry. Let's see if there's any other questions.
Someone's unable to find their 2021 app to complete. We'll have Quality reach out to you.
It's in a weird place. It's under the contracts area. So it is in a different place. Once we initiate that, the VPK app falls under your contracts tab.
Is it possible for us to receive the list of the VPK qualifying children per center?
No, it is not. I'm sorry, for 2 reasons. 1, we don't have it. And 2, okay, that's not right. We do have it, but we can't release it due to confidentiality. A lot of you, though, if you look at your enrollments from the fall, you'll know who those kids are that didn't achieve 70%. So you can look at it. We wouldn't be able to do that timely enough for you. That's the best way for me to put that.
Okay. So a couple of questions, and I think you pretty much just answered them.
Okay.
Do we need 4 children to begin a class?
Nope.
Can our children who did not finish VPK due to COVID attend summer VPK?
As long as they didn't complete 70% of your fall program.
Can you have more children if you have an assistant like the fall, they haven't done summer VPK? So.
No, you have to keep that ratio. So like if you have, and you'd have to have a second bachelor degree teacher in there to go above 12. So we've had, and you'd also have to make sure your group size and you want to follow your ratio. And again, I'm still saying, CDC guidelines. Don't forget, we still have COVID-19 out there. I know sometimes you walk outside and it feels like pre-pandemic circumstances, but if you watch those numbers, they are rising every day, and Florida is rising, one of the fastest in the nation. And I just heard my favorite talk show at lunchtime. I just heard all of them are having to be quarantined because they went to a party together and one person had COVID and has spread it to everybody in their social circle. And the party wasn't even that big. So we still need to be cautious. You still need to practice your cleanliness, your cleaning, wear your masks. out in public, you know, be responsible and take responsibility for your actions, and just know you wearing your mask is protecting me. Me wearing my mask is protecting you. So we're in this together. So just keep those things in mind as you're developing your classroom thoughts, that increased sanitation schedule, all that stuff. So if you wanted to go above the 12, first of all, I wouldn't recommend it. But if you wanted to go above the 12, I don't know what that is from here, you would need to ensure that the classrooms are adequate for that many students, and you'd have to have a second bachelor's degree teacher. Let's see if we have any more questions. And we're good for VPK. I think I already gave you a first responder, essential medical personnel, professionals enrollment update. Again, that's, you know, we talked about the renewal of the referrals. Please encourage your parents to log on to the portal and upload documents that we are asking them for, because if they don't, we cannot renew their services. That's all it is with that. Watch your portal for end dates. So when you're looking at your attendance roster, your end dates should be on there. You want to make sure you watch that. Let's see if there's any questions. No questions. We're going to keep going down the line. Professional development reimbursement. So Scott has a couple things to share with you on that.
Yeah, just a quick update. Last week on Thursday morning, I sent out an email to all providers, just really as a reminder, since we're approaching quickly the end of our fiscal year. We are asking that any and all professional development reimbursement requests that you have from fiscal year 1920 to please be submitted no later than July the 3rd. So if you have any, please go ahead and get them submitted. You would submit those to our quality department. That's Lily Howard and Tiffany Thrasher. Do that as quickly as you possibly can. And if you don't have any, I would just recommend or suggest that you wait until after July 1st to complete those trainings or courses. It's just a couple weeks, and then that way we could process those in the new fiscal year. But if you reference back to my email, it was sent on an early morning on Thursday. So there's links there to the form to fill out. It's the professional development form as well as the W-9 form. So in order for us to process these, we do now require a W-9 form. It's part of the whole process. It's highly likely that several of you on this call already have one submitted with us, so you wouldn't have to worry about that. But you can find the links to the form on our website or in the email that I sent. And other than that, of course, now this reimbursement we're referring to now is different than the teacher stipends with the MiniGrants. So again, that can still be submitted anytime as soon as you have your teachers complete those courses. So in my email, I also put the teacher stipend application for the MiniGrants, as well as the listing of DCF and OEL approved courses that you can take. And I think that's all I've got for that. Any questions on that?
No questions. All right. So the last thing on our agenda is to talk about ELC's operating hours. We have, just like you, gone through this pandemic in different ways with our staff, and we have not closed a single day during this entire pandemic. I'm proud to say we've been here this entire time right alongside you. And we are now welcoming parents back into our office, and providers as well, on Tuesdays and Thursdays from 7 a.m. until 5 p.m. That's the walk-in schedule. We do take the temperature of anybody that walks in our building, including all of our staff. When we come in the morning, we're taking temperatures. I took my temperature when I came in from lunchtime just because I felt really hot, and I wanted to see if that was due to the environment, and it was. It's really hot outside. I know I don't have to tell you that. So the provider workroom, since we're back open to the public, is also back open to you in an appointment basis, on an appointment basis. So Lily Howard, Tiffany Thrasher, or anybody actually in the quality department can schedule you time to come in and work in the provider workroom. Some of the things that we have available to you are, we have a poster size laminator, that huge, I call him Big Daddy. He's on the big desk in there. So that if we know ahead of time that you want to use the big laminator, We're ordering more small pouches for our small laminators. Those we do have out right now. But we have refreshed our supply of paper. We just got in brand new die cuts, one of them being a face mask die cut. So you can come in and, did you try it? Sienna got excited. She didn't know it was here yet. I thought maybe she tried it already. But yes, it's here. So she's going to test it out for us tomorrow. But you can make some face masks if you need to. But we have all sorts of new STEM dies where you can create materials for your classroom that are science related and STEM related. We have almost anything you can think of in there, from creative materials to examples of curriculum to teacher workbooks that you can look through for ideas. So if you need to come in and use our provider workroom, it is yours to use. It's free. At this point, we're doing it by appointment only. So please give the quality team a ring. You can send an email. You can email questions to training@elc-marion.org. You can email them to quality@elc-marion.org. Or if you have a favorite staff member here, you can email it to them so that we can get you scheduled to come in and use that provider workroom. I think that's it. Let's check and see if we have any questions. Marcy's doing like a finger dance, reading your question.
Just to clarify, providers are being paid for children enrolled through July 31st. For emergency essential workers, reimbursement starts only after they attend the first day in the month.
You have it. Yes, Deanna's giving you a standing ovation. So yes, that is, your understanding is perfect and on point. Gold star. Round of applause. And that is it. So you can find these recordings and content on YouTube on our channel. And Marcy just said, nope, hold on. We got one more question in. Type your questions fast, everybody.
Okay. Someone says, have Scott call me. We'll have that taken care of.
Yep.
I'm a little confused about the registration fee reimbursement. I should reimburse my children's registration fee back. Yes. When you get paid that registration fee, it will be up to you to reimburse that registration fee for the past year back to your parent.
That's different than the parent copay. So we talked earlier about parent copays, and I kind of went on I kind of mommed you a little bit and said, you got to return parent copays if the first responder, essential medical personnel, if they've been enrolled retroactively and they've already paid you. Some instances, they're going all the way back to April 1st. That's a long time, and we understand that. However, it is your responsibility to either issue a credit or a refund to those parents for the parent copay. Now, I will tell you, I talk to 98% of those first responders, and I tell them every single time, be prepared to pay a registration fee if the provider charges one, as well as a differential fee, and I explain what that is to most of them. Pay that directly to your child care provider. So that's different than the registration fee that we're asking you to do the survey on EFS Mod about, and Marcy is looking for some details on that. So hang tight for just a second.
No, I'm actually looking for details.
Oh, okay.
Another question.
So the next question that we're going to answer, we're going to go offline for just a second. Don't go anywhere. We're going to answer your question. Hold on just a minute. All right, we're back.
Okay, so one of the next questions was in regards to termination dates on children. In March, April, kids were extended out 3 months for their redetermination dates. And I was trying to get the exact date. I believe June 1st, most of those would have expired and come up for redetermination again. And those have been extended one more time. So that means most of those redetermination dates will end up being due somewhere around that August, September date. So yes, that is something that has been extended. So that should take care of termination dates. Random question, has anyone had any luck finding Lysol anywhere?
Okay, so we have the question, has anybody had luck finding Lysol anywhere? Roseanne said early, if you can get in early, if you have that, is it the business membership that you need to get in early? If you have that, there you go. Sam's Club, we're looking to see if anybody put anything in the chat box or raise their hand if they've had luck finding Lysol. We know we've had some luck going to like the little Dollar Generals and the stores that aren't as big as the Walmarts and the Sam's, Costco's, things like that. Cheney Brothers may have some disinfectant. I know we've been using, instead of Lysol spray, we've been using like the Mr. Clean antibacterial here in the office. Staff just buy it as we see it on the store shelves.
Walmart in the Shores, Microban at Winn-Dixie and Bellevue, Walmart early in the morning, Sam's.
Early in the morning, that seems to be the key, while you guys are all caring for the kids.
Walmart on the Boulevard, Microban is a great substitute. Cheney does not have any.
Cheney doesn't have any, okay.
There's a couple of questions in regards to the registration fees. So basically, the registration fees is going to be paid out in July. We are working on that. OEL does not have it complete yet, but in the next month or two, especially after you do this survey, we are going to start putting together the registration fees. Every provider that charges a registration fee will see a payment. We will have more information on the details of this as we move forward. The very first thing we need for you to do is fill out that survey. Once we have that survey, then the next steps come into play, and we'll be able to get you more information as to how it's being done, how and when parents need to be identified with it, when you'll receive that payment. So all those pieces will come about in the next few weeks. The very first thing, though, is fill out those surveys so we know what we need to handle on that. Clarification for first responders, we have to issue a refund of the registration fee for the year. First responders do not qualify for the registration fee. That is one thing that has been said to us that I know definite. All your other SR children will qualify if you have a registration fee in the portal on your contract. The first responders will not be covered on.
And I do make sure each one of those families understands when I talk to them that there is a possibility that you will charge them a registration fee. Now, we're not saying go back and charge one if you haven't to them, but we do make sure that they know that the possibility that they'll have to pay a registration fee is there.
The survey is on your portal when you go to your, when you go into your main screen on the left-hand side, down closer to the end, you should have two links. It may actually automatically pop up when you go in there, but only the providers that have, yes, registration fees you accept or collect will have that survey as well. So if you have marked on your portal that you do not collect registration fees, you should not see that survey.
Right. Okay.
That's all the questions we have.
That's all the questions. So thank you, everybody. This is a great call. Have a great day. And our next meeting is on June 30th at 1 p.m. So if you'd like to see anything else added to our agenda for that, let us know. Have a great afternoon. Thanks, everybody. Check us out on YouTube.